We are calling this meeting to order of the Health Professions Subcommittee of the Health and Human Services Committee. I would ask you to either take your conversations outside or to go on and take a seat so we can get started. Welcome to the first of 3 meetings of this subcommittee. Welcome back to our members and welcome to Delegate Singh. So we're looking forward to great discussions on the bills and want to remind those in the room and also watching from home that we welcome public comment on HOD Speak if anybody would like to add their input on any of the bills. Excuse me. First off, too, if I could please get a motion at the request of the patrons for House Bill 1861 and House Bill 1904 to go by for the day. All those in favor, say aye. Any opposed? Thank you. So that if you are here for House Bill 1861 or 1904, that means you can come next week on the 23rd when those will be taken up, but keep an eye on our schedule. Thank you. So we are going to start with House Bill 1636. If Chairman Hope can come on up.
Thank you, Madam Chair. Thank you very much. House Bill 1636 expands on our very successful safe haven program. Under current law, civil immunity expands to persons that are participating in programs related to career fatigue and wellness for healthcare professionals to go seek that help. For professional license registered or certified by the boards of dentistry, medicine, nursing, or pharmacy, or students enrolled in those same disciplines as well. What this bill does is expands on what existing current law to include those that have participated in programs in healthcare professions licensed, registered, or certified by the Department of Health Professions or students enrolled in those programs. So it's building off an existing program that we already have that's been very successful and making it more expansive so more people are included. And I'm not aware of any opposition to the bill.
Okay. Thank you. Are there any questions or comments from members? Use your request to speak button. Seeing none. Anyone here in the audience to speak in support? Come on up, please introduce yourself.
Good morning, Madam Chairman, members of the committee. I'm Scott Johnson, General Counsel for the Medical Society of Virginia. We host the Safe Haven program, the Fatigue and Wellness program, and we ask you to vote favorably for this. I believe this program has been addressed by you for 4 years in a row, and I don't think it's ever had a negative vote in this body. So we are pleased to provide these services. Thank you.
Thank you. All right, and we did have... Okay, and we don't have anyone online at this moment. Did you have any final words? And I'm still seeing no questions. So this committee operates by motion.
Move the report. Second.
It's been moved and properly seconded to report House Bill 1636. If the clerk will please open the rolls and members cast your votes. All members having voted, we can close the roll. Thank you. That does report on a vote of 8-0.
Thank you, Madam Chair.
You'll already be at full, but hopefully you won't have any issue there. Thank you. So, Delegate Willett, come spend some time with us this morning. You have 3 bills in front of us today, and we will go in whichever order you choose, sir.
Well, Madam Chair, thank you so much, and we'll just go in order, starting with House Bill 1899. And I appreciate the subcommittee's indulgence. I do have several bills, but we'll get through those. So HB 1899, this is actually, the theme here is keeping a good thing going. We are asking to repeal the July 1st, 2025 sunset provision on legislation that the governor signed in 22 that enables foreign providers, actually instructors, dental instructors from foreign countries to teach here in the United States. The current program through the Board of Dentistry grants a faculty license to foreign dental program graduates who are certified by the Virginia Dental School, that's here at VCU, where the graduate seeks to teach that the applicant and the applicant has clinical competency and experience that meet the credentialing standards. This one point of clarification, this licensure does not allow the graduate to practice dentistry. This is a teaching-only certification. This law has had a great, significant impact on the VCU School of Dentistry in terms of getting in some really top talent into the school coming from these other countries. And as I think most of the committee members are aware, there's a shortage of qualified faculty out there. So we're meeting that need. So it's been a great program, working since 22, and we'd like to see that continue. And we do have the dean of the VCU school here, so I will certainly defer to him for more elaboration, but thank you for the time this morning.
Yes, awesome. Look forward to hearing from them in public comment. And just for the public that may be new to watching, if we have a sunset in a bill, it means that is its expiration date, so to speak. So we would be getting rid of its expiration date in order to keep it going. Are there any questions or comments from the committee? Seeing none, we would love to hear from anyone in support of the bill. Please come forward at this time.
Good morning, ladies and gentlemen. My name is Lyndon Cooper, and I am the Dean of Virginia's only dental school. This bill was passed 2 years ago unanimously when there were 297 open faculty positions in these United States among dental schools. There were 66 dental schools. There are now 70, and by 2029, there will be 79 dental schools, and there are presently over 450 open faculty lines in these United States dental schools. This has been a remarkable success for us. We've recruited 5 remarkably talented dentists with both specialty and PhD training, and they have become some of the best faculty we have. Our intention here is not to just fill a spot, but to seek internationally for some of the most talented dentists in the world to come to Virginia and educate our students. We respectfully request that you sunset the deadline in the current bill. Thank you.
Thank you for joining us. Delegate Tran, did you have a question for the dean?
Yes, Madam Chair. If I may, I do have some questions for the dean.
Sure, he's coming back. Delegate Tran.
Thank you. And by no means are my questions in any way to negatively affect the outcomes of this bill. I support it. I am the daughter of a foreign-trained dentist, retired. And I was wondering, do you look internally within Virginia in your recruitment process for other foreign-trained qualified dentists to teach?
We do. In fact, it's simple for us because we often recruit foreign-trained dentists into what's called our advanced international training program so they can become licensed. They would not necessarily be under this auspices because they go through our program. Most of our searches are deliberate. We know people around the world who have grand reputations, and we go steal them. Yes. Yes. I'm not so sure I answered your question directly, but.
Delegate Tran.
Thank you. Just if I may, I think that it's, if I heard you correctly, like a wonderful opportunity to seek talent from abroad as well. And I just also encourage you to, I think we have communities with rich talent here, and perhaps seeking, and would be glad to follow up with you on ways that maybe we can tap also into opportunities for people who have moved here and made their homes in Virginia to see if this is an opportunity and a match for them too. So I'll be glad to connect with you after that.
Be glad to share the successes of our international dentist program with you.
Thank you. Anyone else here to speak in support of House Bill 1899? Thank you, Dean.
Thank you.
Hi, Missy Wesolowski. On behalf of the Virginia Dental Association, we support the legislation.
Thank you. Is there anyone here to speak in opposition to the bill? And seeing none online, Delegate Willett, did you want to summarize or close?
I think we're good. Thank you very much for your time.
Thank you. Are there any further questions or comments from the committee?
Madam Chair, move to report.
Second.
It's been moved and properly seconded to report House Bill 1899. If the clerk will please open the roll and members cast your votes. And that bill does pass to full committee on a vote of 8-0. Your next one, Delegate Willett.
Madam Chair, thank you. Again, I have HB 1902 before you. This is a bill that I brought forward last year, which made great progress. Unfortunately, ran into a bit of a funding issue with the Senate at the last minute. But just as a reminder for the committee, current Virginia law requires all healthcare providers to check the prescription monitoring program. It's called the PMP before prescribing any controlled substances to patients. However, currently, or under current law, the prescribers do not have access to a patient's overdose history when they're at the critical moment of making these prescriptions. And again, just to tell you things you already know, we have lost way too many Virginians to overdose deaths, as many as 2,500 just in 22 alone. It's a chronic problem for us. So what we're trying to do is to leverage data that's there, data that is collected already. We just need the system, the approval through a system that's already in place to enable the physicians to get access to this. This information is referred to admit, discharge, and transfer, or ADT data. It's collected by the Department of Health through the Health Information Exchange. So the data is there. We need the access to it. There is a budget amendment that would support some code changes, as in coding changes, to enable the access to that information. But again, this would be a critical tool for prescribers to be able to deal with opioid addiction issues.
Thank you. Are there any questions from the committee? And we want to thank you again. I think a lot of us had an aha moment when you brought up the overdoses but live, right? And so this is, I think, a really good bill, if I can say so myself. Anyone here in the audience to support the bill? Please come forward.
Good morning, Madam Chair, members of the subcommittee. Karen Addison with Troutman Strategies, representing Bamboo Health. We support the bill. Thank you so much.
Good morning, Madam Chair. Amy Perrin-Seibert on behalf of the Virginia College of Emergency Physicians, and we support the bill. So when we think it is important and helpful when we check the PMP, that we would see people's overdose information in there. So we support the bill. Thank you.
Good morning, Madam Chair. Victor McKenzie, Substance Abuse and Addiction Recovery Alliance, and we support the bill. Thank you.
Is there anyone here that would like to speak in opposition to the bill? Seeing none, are there any questions from the committee? Delegate Willett?
Madam Chair, again, I appreciate the support for this bill. This is really important. We're going to help save some lives with this. Thank you.
And I think, as the delegate mentioned, an appropriate motion for this bill would be to report and refer to appropriations. Second. It's been moved and properly seconded that we would report and refer House Bill 1902. If the clerk will please open the rolls and members cast your votes. And that also passes on a vote of 8-0. Delegate Willett, your last one for us today.
One more time. I appreciate the indulgence. This is HB 1903, and I want to bring to the committee's attention, I do have two line amendments for this bill. This will be line 78. We're clarifying that this applies to both public and private institutions. That's line 78. And then line 131, we're increasing the payment amounts. That's going to be from $100,000 to $165,000 for line 131.
If I could get a motion on the amendments.
So moved.
Second.
It's been moved and properly seconded that we would accept those amendments. All those in favor say aye. Aye. Any opposed? Okay, so that bill as amended is now in front of us. Delegate Willett.
Great, thank you. Just a quick reminder for the committee, we made great progress this past year with the Virginia Health Workforce Development Authority. I chair that. I also have Delegate Hodges as my partner in crime on that. And the authority is doing great work for the Commonwealth trying to address our health workforce crisis. And I want to recognize that progress, but recognize we've got a few additional tweaks we want to make to our legislation. And I'll go through those right now. There's four things, and by all means, I entertain questions on that. The first one is actually really the most significant one, and that's the creation of what's being called the Virginia Nursing Workforce Center. We have amazing nursing programs in Virginia provided by private schools, public schools, health institutions, health systems, but unlike other states, we do not coordinate this effort centrally right now. And there's a very strong argument that we've seen from other states that when you have that coordination, you actually do better, be more effective in that program, and we think we can get even better results. We still have a nursing shortage in Virginia, and this would be a good way to help to address that. So that's item number one. And there is a corresponding budget amendment with that to fund the center. The second one is also a looking forward, trying to plan better measure, and that would direct the authority to develop a long-term strategic plan for health workforce in coordination with a broad work group coalition, getting the right people at the table, and the bill talks about that. And then the third one, which I think, again, is a great coordination effort, is having the authority work with the new Department of Workforce Development and Advancement. I think everyone knows we've consolidated our workforce efforts in other areas, but the Health Workforce Authority still handles health workforce. So the thought here with this provision is to coordinate our efforts with the Workforce Development and Advancement Department. And then finally, we have a direction to DMAS to increase the graduate medical education maximum award for residency slots. That was the reference to the earlier line item, to take that up from $100,000 to $165,000. For the committee's reference, even at that level, we're still not as high as we could be, and other states are, but it's certainly good progress, and we've got to do everything we can to work with these graduate medical students and keep them in Virginia. Thank you.
Awesome. Thank you, Delegate Willett. Are there any questions or comments from the committee? Anyone here to speak in support of the legislation, House Bill 1903? Please come forward.
Good morning, Madam Chair and members of the committee. I'm Ashley Apple, representing the Virginia Nurses Association. So the current and projected nursing shortage threatens the health and well-being of every Virginian, and it's critical that nursing expertise is at the helm of solving it. There's obviously a significant public interest in maintaining an adequate workforce for the Commonwealth now and in the future. And so the Virginia Nurses Association strongly supports this bill, and we ask that you do the same. Thank you so much.
And just to let those in line know, this is seemingly a bill in really good standing, so if you'll take that into consideration.
Madam Chair, members of the committee, I'm Terry Gaffney. I'm a registered nurse and a nurse educator, and I speak in favor of this bill. Virginia lacks a consistent lens on the nursing workforce, and as a result, we're always playing catch up with the nursing shortage. So I work at Marymount University. I'm a nursing faculty member there. We struggle with recruiting qualified faculty, and right now we're trying to fill 2 positions. When we can't find adequate faculty, then we can't accept a number of nursing students into the program. So every year, Virginia turns away qualified candidates from our nursing programs. We have difficulty finding instructors to take our students into the clinical arena. And finally, we have nurses working in our hospitals who are exhausted and are not interested in precepting new nursing students and new graduate nurses. The pandemic further reduced the academic preparation of students wanting to go into nursing school and do not have the preparation to be successful in that education. This is a huge problem at Marymount University. We're a Hispanic-serving institution. So again, I speak in favor of this bill. Thank you.
Good morning. My name is Beverly Ross, and I represent the Central Virginia chapter of the National Black Nurses Association. I serve as their health policy liaison. I want to call several things to your attention. 1, 13% of our U.S. population is African American, but only 6.7% are nurses. HBCUs at this time have a graduating representation of 7% of the nurses, but yet we only have 2% of the schools. Research has shown that patient outcomes improve when providers and patients are of the same race. Racism and discrimination, unfortunately, continues to be an issue, not only in Virginia, but in the United States of America. The presence of Black nurses will help to decrease healthcare disparities. I am speaking in support of House Bill 1903, and I ask, as a senior with chronic illness, that you support our workforce. We will all need great nurses in the future. Thank you.
Thank you.
Good morning. My name is Shelley Smith, and I am a nurse practitioner who's been licensed here in the Commonwealth for 20 years. I'm currently a professor and associate dean at a public nursing school here in Virginia. I'd like to offer my support of the bill, primarily because for the last several years, the General Assembly has put forward 60 bills to support healthcare workforce development in our state, and we're very grateful for that. And the best way to measure the impact of that is through data. A nursing workforce data center would be very helpful for us so that we could ensure that the various entry pathways into nursing and our pipeline programs are helping us to sort of equilibrate our supply and demand and get a good return on our investment. Thank you.
Hello, my name is Tiffany Covarrubias-Little, and I'm here in support of this bill. You've heard why we have to grow and diversify our nursing workforce. But in the meantime, when those nurses do go to school, it is 4 years of training, 3 years until they're proficient. In the meantime, our median age for nursing in the nation is 46 years old. Here in Virginia, it's quite a bit higher, with the majority of nurses being 50 and above. Our nurses work primarily in a healthcare setting, much like hospitals and specialty care, and 30% have stated that they want to leave within the next year. 19% of our brand new nurses leave within their first year. It is grueling work, and it is wonderful, amazing, but very difficult calling. There is an immediate need right now for us to support our nursing workforce so that we can sustain the workforce, and that is part of what this bill is going to support, sustaining the workforce. Because think about it, if in the next 7 years you think you might need a nurse, we need to sustain that they will be there and be proficient and capable of taking care of us, our communities, and our families. Thank you.
Hi, good morning. Dominique McKenzie on behalf of the Virginia Council of Nurse Practitioners, and we support this bill. Thank you.
Good morning. Scott Johnson on behalf of HCA Hospitals. We support the bill.
Kelsey Wilkinson, Virginia Health Sciences at Old Dominion University, support the bill.
Julia Billingsley with the Virginia Health Workforce Development Authority. We worked with our state partners to develop these recommendations, and for the reasons previously stated, we do strongly support this legislation. Thank you.
Chris Peace, representing Virginia private colleges, 28 member institutions, 15 of which have colleges of nursing. We appreciate the authority, Delegate Willett, Delegate Hodges, all those who are advancing this legislation, particularly the amendment that was adopted today, recognizing the public purpose our private colleges serve, producing in 1 year almost 1,000 degrees, BSN degrees, representing about 40% of all degrees produced in the Commonwealth. We support the legislation. Thank you.
Thank you. Is there anyone here to speak in opposition after all that great information you just heard? No. Okay. Delegate Willett. Are there any other questions or concerns from the committee? Okay. Delegate Willett, did you have any further?
No, again, thank you for the, but this is the authority. We've made so much progress. I think this will actually be one of the most important things we work on in the coming years, and I really appreciate the support. Thank you.
Awesome. Thank you. Delegate Tran.
Madam Chair, I'd like to report and refer to appropriations as amended.
It's been moved and properly seconded to report and refer to appropriations as amended. All those in, oh, no. If the clerk will please open the roll and members cast your vote. All right, that did pass unanimously. Okay. Thank you so much, Delegate Willett, and we will see you next week.
Great, Madam Chair, thank you so much.
Thank you. Delegate Hayes, you can say it. Yes, Delegate Hayes. Right. We will go with whichever you'd like to first.
All right. Thank you so much, Madam Chair, members of the committee. I think we could take HB 1649 first.
Okay, go for it.
Thank you so much, Madam Chair, members of the committee. The Board of Medicine Continuing Education and Unconscious Bias and Cultural Competency Training is what this bill is actually about. It directs the Board of Medicine to require unconscious bias and cultural competency training as part of the continuing education requirements for renewal of the licensure. The bill specifies requirements for training and requires the board to report on the training to the Department of Health and the Virginia Neonatal Perinatal Collaborative. Madam Chair, the pregnancy-associated death rate for Black women in Virginia was more than 2 times that of white women. And unconscious bias is a bias that is present but not consciously held and recognized. It has been repeatedly identified as a factor contributing to lower health care and quality for Black Americans. Unconscious bias can impact patient safety and is directly correlated with lower quality health care, as well as high quality care is integral, as we know, to improving maternal and infant mortality. The American Medical Association, the American Hospital Association, the Association of Medical Colleges have all urged the adoption of unconscious bias training. Madam Chair, members of the committee, this is the legislation that we sponsored last year along with Senator Locke in its form. It actually passed the House as well as the Senate, and we are urging the committee to act favorably upon this legislation.
Thank you, Chair Hayes. Are there any questions or comments from the subcommittee? Seeing none, is there anyone here in the room to speak in support of the legislation? If you will, please come forward.
Good morning, Chair Price. I am Catherine Haynes, the Health Equity Manager for the Virginia Interfaith Center for Public Policy. Thank you so much to Delegate Hayes for bringing forth HB 1649 and also HB 1675. I'll speak to both with one statement to be brief. I could tell you that in recent longitudinal studies of bias reduction training developed by Diversity Science and Dr. Rachel Hardiman and taken by 40,000 healthcare professionals, including working with the Cleveland Clinic, that over 90% of healthcare providers reported that training improved their patient care, enhanced patient encounters, elevated the patient experience, and increased their confidence in caring for diverse populations. There is plenty of research, as Delegate Hayes mentioned, that increasing the patient experience can improve outcomes. Why? Because they are more likely to engage in follow-up care. You might point out that providers in the study did not report that the course improved the care they provided. Admitting improvement would imply that their previous care for Black women needed enhancement, which is rarely acknowledged publicly. Instead, I want to share a personal story that may help you see bias in a different way. Last month, my office mate texted a photo to alert me that there was a guy passed out in front of our office. The photo was blurry. I saw only a man in a red and black checkered flannel shirt with a tuft of dirty blonde hair. I immediately panicked. I was certain a family member had passed outside. I stood up to go outside and help them. My office mate wondered what I was doing. That is unconscious bias. I slowed down my thinking and realized the black checked flannel shirt reminded me of my family members with addiction status. I knew it could not be a family member, and I did not exit the office immediately. A bias is a shortcut in the brain. It is unconscious until you slow down and recognize it. And then, like I did in that case, you can make a different decision. I hope that those who do not yet support this bill make a different decision and that we have the same almost unanimous vote in the House this year that we did in the Senate so that we can improve the lives, the health care for Black women and all women and birthing individuals in the state.
Thank you.
Madam Chair, members of the committee, Emily Moore with Voices for Virginia's Children. We want to thank the patron for continuing to champion this legislation. We know we've done a great job in Virginia of increasing access to maternal care, and yet we just heard from Janet Kelly, Secretary Janet Kelly this morning in Senate Finance and Appropriations, that there is still 138 per 100,000 live births for Black women that result in maternal mortality. So we have a lot of work to do. We know that racial bias is a life or death situation for many women, and hope that you will favorably support this bill. Thank you.
Good morning, Chair, members of the committee. My name is Victoria Richardson. I'm an attorney with the Virginia Poverty Law Center, and I work with healthcare issues. First off, just wanted to thank Delegate Hayes for bringing this very important piece of legislation. VPLC strongly supports this bill because we support equity and health outcomes for Black women. Thank you very much.
Thank you. Is there anyone here in the room in opposition to the bill?
Madam Chair, members of this committee, my name is Dylan Bishop, and I'm here today on behalf of Do No Harm Action. And with all due respect to the patron, I've been asked to oppose the bill on their behalf. Do No Harm Action represents physicians, nurses, and healthcare providers focused on keeping identity politics out of the practice of medicine, medical education, and medical research. We believe in making healthcare better for all. Incumbent to this is the Hippocratic Oath that all providers swear to uphold, just like you as legislators swear to uphold the Constitution. And I'll quote from that just briefly, if you'll indulge me. Part of the Hippocratic Oath, I shall try to establish a friendly relationship with my patients and shall accept each one in a non-judgmental manner, appreciating the validity and worth of different value systems and according to each person a full measure of human dignity. I shall work with my profession to improve the quality of medical care and to improve the public health, but I shall not let any lesser public or professional consideration interfere with my primary commitment to provide the best and most appropriate care available to each of my patients. And it is Do No Harm Action's position that this is yet another training requirement that already strains an overburdened healthcare provider workforce. Our physicians now only see their patients on average for about 6 minutes per patient, and we believe that they're already stretched so thin, and this is just another requirement on top of that to ensure that they are upholding an oath that they've already sworn to uphold. And for those reasons, we'd ask you to oppose the bill. Thank you, ma'am.
And I do realize that you are speaking on behalf of your client, so I would like to offer a message back to them that if it's only 6 minutes, and within those 6 minutes there is bias present, then that actually is harm, and that the statistics that we have heard show that harm is being done. So what I'm hearing the training would be is to help bring to the consciousness things that may be underlying in order for the harm not to be done. But when you have a woman saying, I'm in pain, and racist teachings from the past have you looking at that Black woman and saying she experiences pain differently, like a majority of doctors said in a 2016 UVA study, that is harm. And so this bill, in my reading of it, as the delegate has explained, would help get to the moniker of what your group is called, of the Do No Harm. And so I would ask that you get that message back to their membership. Thank you for speaking today.
Yes, ma'am, of course. Thank you for your time.
And we'll go online now. We have Dr. Nicole Wardlaw, graduate of Spelman College, here to speak to us today. Please share your thoughts.
Good morning, Madam Chair and everyone there. I'm going to say that I am a certified nurse midwife. I have been a midwife for 19 years. And yes, when I was trained, I learned that Black women don't breastfeed and that we do not experience pain in the same way. And so while we are taught to do no harm and we swear to do no harm, there is implicit bias in our training. There's implicit bias in practice. And I have taken implicit bias trainings as a part of my CEU requirement for other states. And I think that in the state of Virginia, that also needs to be mandated and required because everyone has bias. Even as a Black woman, I realized the bias that I didn't even realize I had. And so if we have to do CEUs for our licensure, that should be one of those mandated CEU requirements. So I am strongly in favor of that. And I speak for myself, for other midwives, and other providers. If we are putting our hands and touching people, then we need to understand first what biases we have so that we know how to address them before we care for others. Thank you, and I yield.
Thank you. Are there any other questions or comments from the committee? Delegate Hayes, before I give you the last word, I am definitely taking the chair's prerogative here. But I remember in 2016 when Senator Aird and I were ringing the alarm after we heard Beyonce's story, Serena Williams' story, Judge Glenda Hatchett's daughter-in-law's story, and then the outpouring of just people from around the Commonwealth talking about their experiences. And since then, it went from two of us screaming at a brick wall to now we have had with the Speaker and Madam President's leadership and with your leadership, the Black Maternal Health Summit this year. We also heard the disparity in Black maternal health mentioned at the State of the Commonwealth Address. And so I am hopeful that at 10 years in, we might actually be able to get to some solutions and not just talk about the problem. And so I appreciate you for bringing this forward as it pertains to that. And I will give you the final word.
Thank you so much, Madam Chair. And you've said, in essence, everything that needs to be said on the matter. But I'll just like to say that it's important for us to get rid of the notion that we aren't biased, right? There's a thought that says that the bias is what the problem is, that people don't want to recognize the fact that there actually is bias. And so the sooner we begin to address that, whether it's from the stories that are told, or whether it's from trusted medical organizations that all medical providers and practitioners respect. This isn't something that's coming out of the air where folks are just pulling out of the air some idea, but it's science and facts that have been presented and backed up the fact that there is unconscious bias in healthcare, and more specifically, we're addressing it through this particular bill here in maternal health, but all throughout. And with that, Madam Chair, I'll just ask that the committee act favorably upon this legislation.
Madam Chair.
Yes, Delegate Cole.
Move to report.
Second. It's been moved and properly seconded to report House Bill 1649. If the clerk will please open the rolls. And that bill does pass on a vote of 5-2. And Delegate Hayes, if you will then go to House Bill 1675, and I know they're related, so if you would like to introduce that, but specifically what some of the differences are, so because we noted it's not the same bill.
Right. Thank you so much, Madam Chair, members of the committee. You have before you House Bill 1675, and this also addresses unconscious bias. This actually is a bill that's supported from the Joint Commission on Health Care as a recommendation that has come from that body that we address unconscious bias when it comes to sickle cell disease. This legislation was recommended by the Joint Commission. It also, through its study of the Commission, found that unconscious racial bias can lead to delays in the treatment for pain-related conditions and contributing to accelerated disease progression and poorer outcomes. Studies suggest that patients with sickle cell disease experience pain crisis who seek treatment in emergency departments experience significant delays in receiving care, waiting on an average of 70 to 75 minutes longer to receive initial doses of pain medication than is recommended by the American Pain Society. Madam Chair, members of the committee, research also shows that healthcare providers often perceive adults with sickle cell to have increased risk of substance abuse, making providers hesitant to administer opioids for pain treatment despite evidence to the contrary. Requiring healthcare providers to receive training and education is going to help providers better understand the impact of stigma and unconscious bias on access and on the quality of healthcare services. Madam Chair, the legislation would require continuing education and unconscious bias cultural competency for the renewal of an active license issued by the Board of Medicine as well. So not only the initial training as you get your license, but on the renewals as well. That, in essence, is the difference, Madam Chair, members of the committee.
Thank you. And I remember hearing the audible gasp when at the Joint Commission on Healthcare when some of those wait times were being mentioned. Are there any questions or comments from the committee? Anyone here to speak in favor of the bill? Anyone here? Oh, sorry, didn't see you. Come on up.
Catherine Haynes, Virginia Interfaith Center. I forgot to add last time because I was a little emotional, but the PUSH Coalition, which the Virginia Interfaith Center leads, worked on doubling our membership this year so that we could have a solid presence in rural Virginia with the hope that that could lead to more House votes. And so I just wanted to add, we are now 43 organizations, and that presence includes the Dan River Region Maternal Health Task Force, the Health Collaborative, the Infant Maternal Health Coalition in South Boston, the Maternal Health Task Force of Martinsville-Henry County, the Tri-County Community Action Agency, the Virginia Community Health Worker Association, the Virginia Rural Health Association, and many others across the state. And everyone endorses unconscious bias training. Thank you.
Thank you. And for those that spoke in favor of the last bill, if you could just raise your hand if your previous comments would reflect to this bill as well. Thank you. Thank you. Is there anyone here to speak in opposition to this legislation? Or if you've already spoken and you just want to register that same opposition. So online, we do have Dr. Wardlaw. If you'll unmute.
I'm co-signing again.
Okay.
I have family members who have been treated unfairly when it comes to sickle cell disease. They're treated like they're drug seekers. And I've had pregnant patients who have gone in, and if you've never had a sickle cell crisis, then you do not understand that pain. And so we need that training for people to understand truly what it feels like to be on that side of care, to be the person who needs that care. Thank you.
Thank you. Are there any questions or comments from the subcommittee? Seeing none, is there a motion?
I'd like to move to report. Second.
It's been moved and properly seconded to report House Bill 1675. If the clerk will please open the rolls and members cast your votes. And that bill does pass to full committee on a vote of 5-2. At this moment, I am going to ask for Delegate Hayes to take over so that I can present our final bill of the day, House Bill 1860.
Thank you so much. Yes.
Okay, thank you. So House Bill 1860 is seeking to help a need, as we've heard earlier with nursing. There is a shortage, and specific to some nursing education programs, they do not have enough clinical faculty to support the nursing student demand. And this legislation allows the board to waive ratio requirements for nursing schools to have one clinical faculty member for up to 15 students providing direct care in certain situations. So it's a Section 1 bill, and under these changes, again, the education program would be able to apply for a waiver and provide evidence to the board that the program has an appropriate implementation plan, has demonstrated that the program can safely waive the required ratio, and demonstrated that the waiver would support program needs while maintaining the safety of the patients and the public. So it is permissive and also based on a waiver process. And at this moment, Mr. Chair, I do have a substitute. And if one of the wonderful council that we have present could explain what the substitute does.
Council? Thank you, Madam Chair. You actually were explaining the substitute already. So if you want to continue with what you were saying, you already were explaining it. I'm more than happy to discuss it as well.
That's a relief. So if I could get one of my colleagues to move the substitute.
Second. Oh.
Second.
We have somebody second.
Second. So moved.
Second. It's been moved and properly second that we accept the substitute.
Okay, so as I was saying, now with this substitute in front of us, we just want to reiterate that currently the regulations limit the ratio of faculty to students engaged in direct clinical care to 10 students per faculty. So this would be so that the board could waive those regulatory requirements to permit a ratio of faculty to students engaged in direct client care to 15, up to 15, provided that the program did demonstrate what I just mentioned. I want to thank the Department of Health Professions and Secretary Slater for their teamwork on this bill, and I can defer to them if there are any questions.
All right, you've heard the presentation on the bill. Members, are there questions? Seeing no questions from the members. From the public, are there any persons in the room that would like to speak in favor of this legislation?
Madam Chair, members of the committee, I'm Ashley Apple, speaking on behalf of the Virginia Nurses Association. As a professor of nursing myself, this is an issue, of course, we take very seriously. We strongly support this bill, and we're very grateful to our partners in the administration, to the Department of Health Professions, to Secretary Slater, Deputy Secretary Mills, for working with us and coming to the table. It was really productive, and we appreciate their attentiveness to safety, ensuring safety, but also allowing innovation when it comes to combating the current shortage of clinical faculty. A sincere appreciation to Delegate Price for bringing this bill. It has our full support, and we hope you'll support it as well. Thank you.
Thank you. Others in support?
Morning, Mr.
Secretary
Chairman.
Slater.
I'm Brian Slater, Secretary of Labor. I just wanted to say that we fully support this bill and thank Delegate Price for working with us and thank the Nursing Association and DHP staff for working with us. We believe that this helps address the chronic problem of a shortage of nurses in the profession, and we've worked very closely to come up with something that everybody is happy with, and very appreciative of all the stakeholders working with us and fully support the bill. Thank you, Mr. Chairman.
Other persons in? Yes, sir.
Good morning, Jim Jenkins, Special Advisor for Healthcare Workforce. We're grateful to Delegate Price, and I'm also a registered nurse, so I've experienced this from the nursing student side. I've experienced this from hosting nursing students in the clinical setting, in the emergency department and intensive care unit. This is an opportunity to help potentially graduate more nurses a little bit sooner. We are grateful to the nursing associations for their conversation and input and guidance, and we thank you all for proposing the bill.
Thank you so much. Others in the room speaking in support? Seeing no others, any in the room in opposition? Seeing none? And we do have online testimony. And so we'll go to Nicole Wardlaw. My apologies.
I feel like this would be my, I should have been there, but I'm wearing my adjunct faculty hat at this moment. So I strongly support this. I'm adjunct faculty at Hampton University, where we are suffering from having these clinical faculty shortages, and we're not able to accommodate all of our students. And so when we expand the nursing faculty ratio, then that allows us to take more students and be able to address the nursing shortage. So I am grateful for this bill. Thank you, and I'm strongly in favor.
Thank you so much. We appreciate your testimony here today. All members, all minds clear. Clerk, if you can open the roll. On the substitute.
Second.
It's been moved and properly seconded that we vote on this substitute. The substitutes before us. All those in favor signify on the board. Nays have the same right. And the measure has passed 7-0.
Thank you so much, and I'll take it back just to say thank you all for your patience. Thank you all for your input and attentiveness today. We will meet again next Thursday with a little bit more fireworks, but looking forward to intense conversations because we always get good solutions with intense conversations. I will entertain a motion to adjourn. It's been moved and properly seconded that we shall adjourn. All those in favor say aye. Aye. Any opposed? We are adjourned. Thank you.